Okay, welcome back for our next panel. We've got one more wonderful panel on learning from financing interventions on youth mental health before we go back to lunch. So I promise more food and snack and chat is coming. And I'm so glad that we're like feeling the inspiration and the wonder and the, the passion to be talking and chatting and connecting. It's really lovely to see, actually. So we're going to get started. It's my pleasure to introduce Dr. Jennifer Requejo, who is a commissioner on this Lancet Commission and a senior advisor with the Global Financing Facility for Women, Children, and Adolescents at the Wellbeing Group, as well as a senior scientist at the Johns Hopkins Bloomberg School of Public Health. So over to you, Dr. Requejo.
Thanks, everybody. As you know, we are now moving into the money panel. So we're going to be talking about how we fund the entire chain. So from addressing research gaps and knowledge on how to intervene, how those research interventions can then be moved to something that's sustainably financed for interventions in practice. So I'm very excited to be able to moderate this panel. And first, I'd like to introduce you to our panelists. You do have their bios in the program, but just quickly, I'm going to give a little bit of some introductions. So first is to my left is Miss Aliza Lopez. She is a health advocate and she's currently a student at the University of Rochester. She's the founder of Medicine Encompassed, which is called now the Reconceive Project. Her focus is on youth health advocacy in over 40 countries through experiential learning and programs. She's worked with health organizations, including Headstream, Mental Health America, and many others, and has received lots of accolades for all of her work. So it's great to have her here with us to bring forward the youth perspective, and be great to hear from all of her experiences. We have two colleagues who will be joining us online. The first is Dr. Ellen Morgan. Dr. Ellen Morgan leads the identification, development, and evaluation of research and implementation projects under the Global Innovations for Character Development Initiative. She previously supported the Grand Challenges Canada's Global Mental Health Program and was a contributor to the Lancet 2017 Commission on Mental Health and Sustainable Development. So it's great to have her here, and we'll get a lot from her perspective from the donor viewpoint and all of her other work. The other colleague we have online is Dr. Nicole Bardikoff. She is the mental health lead at Grand Challenges Canada. In this role, she oversees investments and partnerships supporting the mental health and well-being of young people in low resource settings, including she is also leading the Being Initiative. So we will also hear a lot from her, again, from a donor foundation perspective. And then lastly, over here to my left in person with us all is Dr. Tracy Johnson. In 2000, Dr. Johnson founded Health Policy Solutions, which is a consultancy firm focused on Medicaid and population health. Before founding Health Policy Solutions, she was a senior advisor for Medicaid for the Center for Medicare and Medicaid Innovation. She also served as the Colorado Medicaid Director for a few years, and also the National Association of Medicaid Directors Board member. And she's also an alumni from Johns Hopkins, so we have to flag that. Anyway, so that is who you will be hearing from today. And now I'd like to turn us over to the panel. I'm going to start with you, Aliza, who is going to outline selected gaps identified through the project Fund the Youth, which highlights the challenges of youth participation and success in securing funding for mental health initiatives. So over to you.
Should have a clicker up there.
Okay, awesome. Hi, everyone. I hope you're all doing well. So my name is Aliza. My pronouns are she, hers. I'm a very big youth mental health advocate, and currently I work at Headstream as a program coordinator, and it's a really great organization that supports fellow behavioral health organizations and companies that are also serving the youth demographic primarily. So it's really interesting to kind of provide both that programmatic as well as that youth perspective in this work. And for this, I really just wanted to talk about the importance of what it means to fund youth and what equalizing accessibility to grants and other financing options for youth-led mental health initiatives really even means to us. So the first thing I really just wanted to cover is that, as you've obviously seen in this panel, and as you've obviously seen with just the entire event about adolescent mental health, this is a very big social investment in us, as Gen Z and young people bring such an abundance to the table and their unique perspectives in their work and their ideas. And one thing about us is that when we identify a gap that we really want to address, we will take the actions that we need in order to attain that. So we will make use of those resources available to us. And as young founders and leaders, if we don't get this funding to scale our own missions and our programs that we launch, then unfortunately our ideas will tend to wither. Even despite our drive and our determination, which gets us so far, unfortunately, funding is a very big factor about really just bringing our movements to an even bigger scale than it originally had to begin with. So I wanted to talk about the launch of Fund the Youth, which was a campaign and a movement that was started within myself and a few other esteemed mental health leaders in this space. So this really started because we were at the 2023 Mental Health America Conference, and the assistant secretary, or the previous assistant secretary of SAMHSA, was there at the time, and I believe she was speaking on a panel, and one of our founding members of Fund the Youth said to her, how exactly can we make grant processes and just financing options more accessible to young people? Because there are so many systemic barriers in this process. So this has been the main guiding question in all of our work, just because youth, as we can see, are very much at the forefront when it comes to mental health advocacy. We are so in tune with our own generation and our own interests that it only makes sense for us to create these initiatives and to create these new innovations that really speak to what youth need the most. And youth are, again, very familiar with the many mental health struggles that are affecting our own generation. So I've definitely seen my own peers launch initiatives that deal with mental health policy, being able to testify to representatives, or even just creating more mental health resources and education for our fellow peers. So as you can see, we're very in tune with how exactly we can advocate for our own generation. So I just wanted to touch on the value of funding for youth-led projects. And again, just because it has this label of, oh, like it's being led by youth, that doesn't necessarily undermine its value because our advocacy is still so powerful. So obviously there are very big operational costs that go into any initiative. This can include equipment that we may need for events or any resources that we might produce. Also staff salaries and just making sure that youth can be properly compensated, because if you were here for the panel yesterday, I believe some of our youth were talking about even when youth are consulted, they aren't properly compensated for their work, whereas adults are always expected to. So why should there be a difference in the way that youth are properly recognized? And also technology is a very big part of our projects. Technology has really revolutionized the way that we're able to reach such a big global audience and make sure that our education is really getting to as many areas as possible. Obviously, program implementation and expansion will be an inherent need. Naturally, as we start to reach out to more people, that also goes into capacity building and just a lower risk of financial instability as well, because a lot of organizations do provide mentorship along with that funding, and we won't have to rely on a single source of funding when it comes to our initiatives. So for the current state of funding for youth, a lot of youth leaders like myself, we've all seen that there are so many options out there. There's a combination of both public and private funding, which all have their own advantages, as well as some of their shortcomings and barriers that we've seen in the field. However, there have been so many different systemic barriers in even accessing this funding, or even how it's equitably distributed to youth, which I will talk about in the coming slides. Young people have experienced numerous struggles when it comes to being able to apply for these grants or even accessing these grants in the first place. A lot of these barriers are rooted in factors like implicit biases in the reviewer, just having unequal opportunities to begin with, as well as just inaccessibility in general when it comes to the process. So there are a lot of different underlying systemic issues that I think should really be addressed when it comes to this. So for nonprofits and just charitable causes in general that youth have led, grant making has been historically inaccessible and very inequitable. So the first one that I wanted to point out is just obviously the very, very extensive writing process that a lot of youth have kind of come to terms with, and they realized that, oh my God, like a lot of these like grant making organizations, like they have such strict limitations in what exactly the mission the organization is putting forward, what exact goals they're writing about, just very, very exact terms that they have to meet. And if it doesn't align with the priorities and the goals of that grant making organization, then it's pretty probable that their application will be eliminated or not really considered as heavily in the process. And I also like to think of this as a very vicious cycle behind grant making, because a lot of these grant making organizations, they do expect through these applications that the nonprofit applying to them is expected to have such extensive impact, so many quantitative details and so many statistics that attest to the fact that they've done this impact in the past and they know how to execute these types of programs, which is a certainly valid take. But if youth aren't even given the means to create this impact and actually achieve these kinds of statistics, then how would they even have this leg up in the process? Youth also face just a general lack of resources, mentorship, and connections, objectively compared to someone that maybe, I guess, like more of like a senior leader in the space. There are like very, very technical terms that these grant applications do include, which youth may not just be familiar with. And there are so many different components of this application process that, again, youth may not really be as acquainted with either. So again, it kind of gives them this disadvantage in the process. Youth are also, I guess, more in an underprivileged position when it comes to this. So a lot of youth don't really have those, like, I guess, like funding under their belt already. They might not already be in these like full-time, like higher, like paying jobs. A lot of times, like this funding will come from out of their own pocket. And oftentimes, like a founder that may be of a lower socioeconomic status can't really cover the cost of being able to launch their own initiatives because it has to be reinvested into their own personal causes first. Geographic barriers are also a pretty big factor that we have to consider. Some youth founders may come from, let's say, like rural as well as remote areas, which may not have like the greatest like connectivity to different resources. They might not be able to access the proper networks that would allow them to be able to be more knowledgeable about this topic. So again, this kind of poses a very big disadvantage to them as well. So as we can see, the funding process in general has been very, very restrictive for youth. As I mentioned, grant organizations often do have these very restrictive limitations as to what exactly the mission statement of that nonprofit applying to that grant must have. So it's important that we address this. Grant making is also a very big bureaucracy. As we can see in the grant making process, there are very, very clear power imbalances that are made. And this really raises a lot of questions about the powers that exactly have this autonomy in deciding who is deserving of this grant. It's almost ironic that grant-making organizations who are inherently in this power of such big authority and such privilege are the ones making these decisions. But in reality, this grant that the nonprofit is requesting to use will ultimately serve another target population. And this is often a marginalized population within mental health. So again, it is pretty ironic that that community doesn't really have any power sharing abilities, but rather this goes to another privileged organization. So it really just raises those questions like whose priorities are being valued more? Is it the grant making organization that's imposing all of these very strict limitations into place? Or is it the actual community who should be deciding, okay, what is most beneficial for my own community? So with Fund the Youth's advocacy, so we were able to get in touch with SAMHSA just because we are very connected with organizations like Mental Health America, and they do have some individuals as part of that organization that were very fortunately willing to help us with this process. So about a year ago, we were able to communicate with some SAMHSA like senior advisors to the previous assistant secretary, as I mentioned earlier, because that is really where the inception of Fund the Youth really even started. So we were able to kind of talk more about identifying specific barriers in SAMHSA applications and the grant making process, as well as just the process in general, not necessarily affiliated with SAMHSA. And we were also able to provide them with some insights on how youth grants are exactly allocated, because that is also something that they were more curious enough to know. So as part of this advocacy, we also wanted to provide 2 asks that would be stepping stones for democratizing youth grants and just overall improving the application process. And even though this wouldn't be an immediate implementation, it would at least be good for them to know what exactly youth are requesting and what exactly they need in this process. And we were also able to present this session at some other conferences. So it was really nice that we were having this additional audience that we could raise awareness for. And we are also trying to focus on mobilizing young people as well from the local level, because we recognize that SEMTA, of course, is a federal organization. So it's good to do this community work on different scales as well. So this is just like a screenshot of the letter that we initially had sent to the assistant secretary and her office. So it just provided more information about why exactly grants and financing options for youth are so critical, what exactly this funding would be used for, and the outcomes of this. So this is just one of our proposals that we had. Obviously, we can't really say that our ask would be the exact same now, just considering all of the restructuring and grant allocations as well as cuts to funding. But this is definitely an initial proposal that we had in mind, and we even mentioned to the senior advisors that this would be very, very flexible. But we definitely said or suggested that it would be great to use their discretionary funding to allocate a budget for the purpose of having more youth-centered grants. And this is because of the fact that, again, youth and young folks are really at the forefront of mental health advocacy today. So it's only right that we provide them with the resources in order to really progress their initiatives even further. So with this ask, we would definitely have an institutional partner of interest, which would be Mental Health America, considering that they are a registered nonprofit under the US, and they would definitely be able to help out with supporting other fellow mental health initiatives led by youth. And the second solution that we also proposed, which I think is definitely unwavering even today, is just the fact that we should have an intergenerational advisory council that includes people from the community as well as specifically youth that would either for the purpose of creating recommendations for grant makers that fund youth-led mental health initiatives. And as I mentioned, this really goes into the whole purpose of power sharing, because these grants are going to serve the nonprofits that do directly serve these marginalized populations. So again, it's great if we have these youth that are actually being impacted and making the decisions that ultimately will again go into their quality of just how they experience mental health. And oh wait, there is another slide, but I don't know if it's working. Because I'm not pressing the next button on the slide. Okay, wait, now it's working. Oh, okay, now it's working. Okay. Okay, so just considering all of this, I wanted to talk more about the future of funding. So these were youth's recommendations specifically from our Fund the Youth team. So of course, we want to take more of a democratic and bottom-up approach, because this is so much better as opposed to a top-down approach where, of course, as I mentioned earlier, we can't be putting people or organizations that are already in such an inherently privileged position and not even being directly impacted by these initiatives as the main people that are governing where this funding goes. We should really place this in the hands of our community. So this might look like citizens being able to also evaluate applications, and they also serve on an advisory board. We should definitely focus on incorporating youth voices as well. And this really helps to build trust in these decision-making processes. And I also wanted to mention, as it says on the side, building this trust is really great for greater transparency and where, why, and how grants are being allocated. It would ensure that power is not just being placed in the grant maker's hands and that the process is just overall very cryptic. We don't know what exactly their rationale was. We don't know how they thought that it was serving the community or their purpose. But it's good for community members to know that, yes, these grants are actually being allocated with that community in mind. And of course, as I mentioned earlier, it is good to just overall reduce implicit biases when it comes to grant application reviewers. Another concept that I wanted to mention is trust-based philanthropy, and this differs from the standard model. Some characteristics that it includes is just overall shifting power and improving existing relationships. So essentially, donors would act more as a partner rather than seeing the organization as a patron. Another characteristic of this is that trust-based philanthropy really relies on unrestricted multi-year funding. So instead of an organization having to apply every single year for this and having to go through the same extensive grant-making process every single year, there's essentially that trust being built because that organization now has the ability to use this funding in whatever capacity they choose to, as long as it does align with the general mission of benefiting the population that they say they're going to benefit. So besides just obviously that financial investment and monetary support, they're also getting additional mentorship from the organization. A lot of the times in trust-based philanthropy, the grant-making organization will actively seek out smaller organizations or initiatives in the community rather than the other way around, where the smaller organization has to really go out of their way to seek like a grant maker that really tries to invest in them. So again, that really increases that trust, and it lets them know like, hey, like we know that you have the potential to do great work. We know that you're going to do great work and that you have a vision. And this is definitely the type of approach that you would want to see going forward. So thank you so much for listening to this, and feel free to contact me via email and connect with me on LinkedIn, and we can definitely talk about this more, as well as just youth advocacy in general.
Thank you so much for so thank you. That was wonderful. Really appreciate it. It's great to have the starting point of the panel from the youth perspective to really ground everything in like the ethos of the commission and the ethos of this conference of hearing from youth voices, and also just even bringing it further to this point of youth engagement in the whole funding cycle as well. I think it's just excellent. So thank you so much for that. Now we're going to turn over to Ellen and Nicole, who are going to be doing their presentations that are synergistic, or they build on each other. Ellen is going to, and this is now coming from the donor side, so you've now just been given a whole bunch of recommendations on democratizing the grant making process. So, but we are going to hear from Ellen, is going to talk about the gaps and challenges that TWC hopes to bridge, solve, and then she's going to go into a description of early stages of intervention and pipeline testing, focusing in on mechanisms of mental health promotion and prevention of mental health conditions. Then we'll hear from Nicole about the state of the evidence around addressing mental health needs, but that might be in place, but there's the larger problem of scaling. So we will hear from her about that. And then we'll hear also a little bit about GCC's funding of ecosystem grants that will help with identifying and addressing roadblocks to this whole scaling issue. And we'll also hear from both of them about their organizations and their work that they're doing on mental health. So I'm not entirely sure who is going first. I think it's you, Nicole. So maybe I'll hand it over to you to get started. So thank you so much. Is it Ellen? Okay, never mind. We take that back. So Ellen, over to you to start.
Yeah, thanks so much. And thanks very much for having me on this panel. I'm looking forward to the discussions that follow too. So just by way of brief background, so Templeton World Charity Foundation, whom I'm a consultant for, it's a private philanthropic foundation and with a relatively unique mission, which is primarily to discover and accelerate progress in the spiritual search for meaning, purpose, and truth. And so as a private research funder, we tend to focus on funding at the early stages of the intervention, development, and testing pipeline. So that has to do with basic science, formative questions, intervention idea generation, and all the way up usually to randomized controlled trials. And we're really well positioned as a private foundation to sort of take on some of these earlier stage, riskier ideas. And we're less well positioned to take things to scale. So I'm going to be talking a little bit about that sort of early stage perspective and what we can consider doing to set interventions up for success at scale. Just by way of a bit of background, the foundation is particularly interested in, under the character development program, in sort of identifying and really promoting the role of what we call character strengths and skills in and better understanding their role in health and well-being. So when we're talking about character strengths and skills, we're referring to things like forgiveness, gratitude, self-regulation, hope, and agency. And over the past sort of 7 or 8 years, the foundation has invested about $20 million in 50 projects in 25 countries that are really looking at sort of the development and testing of interventions to promote these skills, with a really important subset looking at how does the development of these strengths and skills really promote sort of mental health and other forms of well-being. So that's the perspective that the foundation is coming from. And I think some of the things that we've learned over the last 7 or 8 years about how to sort of support interventions for scale comes down to, firstly, trying to really select at the very, very early stage, sort of interventions and teams. Most importantly, it's actually the people in some ways, not the idea itself, that have sort of the potential and the connections and the interest in having long-term impact. And so as a foundation, in addition to providing sort of grant-making funds, we've always taken a really specific focus on what we would call capacity and community building. So sort of investing in the researchers and innovators who receive our grants and who become part of this larger community, whether it's to sort of develop their skills, to provide funding for dissemination and uptake. And I think that the other thing that early stage funders can potentially do, which I think there's a lot more we can do in this space, is actually to work with other funders who are potentially funding at larger stages, sort of down the pipeline, in order to make sure that we're talking and we're trying to figure out ways where these really great ideas that have maybe been seeded by one funder are able to be positioned and taken up at scale by another funder. And I think in general, in the funding ecosystem, there's a lot of reasons why this doesn't happen, but I think that in general, we could all be a lot better at sort of coming together and trying to think of this at a really early stage, which is why I think it'll be really exciting to hear from sort of Nicole and the Being initiative, because they've taken, very much a multi-funder approach. Now, I know we have some opportunities to discuss a little bit later, but I wanted to take the chance also to respond to what some of my colleagues on the panel have just mentioned about sort of a lot of the inequities that there are in access to research funding. And it was great to see those laid out so clearly, because it's definitely something that we see from the perspective of funders. And I think one of the areas that there's room for a lot of, I think, more inclusion of youth is really actually in the peer review process itself. So we tend to think sort of at the ideation stage, making sure that sort of youth have access, are engaged. But when it comes down to the peer review process, I think in general, we as funders tend to seek sort of technical reviewers with technical expertise, and there's not always sort of the engagement of people with lived experience in the review process, for example, or in the case of youth innovations with youth. So I think that's one area we could definitely improve. I'd love to hear others' thoughts on that.
Great, thank you so much, Ellen. I really appreciated your couple of those really important statements around the ecosystem and the connection between the sort of earlier stage funding with the groups that are working on scale up. And also thank you for responding already to some of the challenges that have been posed around options for increasing youth engagement in the grant process. I like that idea of adding them as peer reviewers and also at the ideation stage is great. So with that, I think we have a really nice segue over to you, Nicole, to talk about this next step around the scale up of mental health interventions. So over to you.
Yeah, thank you so much. And thank you so much for having me on this panel. I'm really looking forward to the continued discussion. I'm so sorry I can't be there in person. I did maybe have slides for this. If they're not there, that's okay, and I can wing it.
Hang on one second. Somebody is pulling them up.
Okay. Yeah, perfect. I was gonna say, how much do I trust my memory on this? Maybe not enough. Okay, yes. So here we go. Yeah, so joining you from Grand Challenges Canada, thank you so much. I'm going to be, unfortunately, the person that's going to have to keep saying next slide, but we go to the next slide. For anyone who isn't familiar with GCC, we are a global impact investor and an innovation platform, and our goal is really to support bold ideas that have the potential to save and improve lives in underserved communities. And specifically, we fund and support the scale of innovations that improve the health and well-being of individuals in low and middle income countries. So we're bringing the perspective that I'll be bringing is less about the U.S. context, but more about some of the learnings from the global context that can be brought to bear in this context as well. So we'll go to the next slide. Yes, all right. So just a brief background. So we do this by launching different thematic funding calls. We provide catalytic financing. So we have a range of different financial instruments, everything from grants to debt and equity. We also provide tailored non-financial support and smart partnerships to help innovators unlock potential. We really see our role as about de-risking innovations and supporting being able to position the most promising solutions for scale and sustainability, in some cases for public sector adoption. And our goal is really to invest in innovations that can be sustainable, that can lead to this long-term independence, sometimes even with financial returns, which we then invest into the next generation of solutions. So next slide. Thanks. So just giving a little bit of background context again of just what GCC and what I'm speaking about. Our success is really based on the number of lives reached, lives saved and improved through the innovations that we fund. We do require quite rigorous evidence to demonstrate impact, and we provide funding and technical assistance to generate this. And so this is all really leading me to what I really want to be talking about, which is our work funding in mental health. So we have a global mental health program and the Being initiative, which has been mentioned, which is our youth-focused mental health funding initiative, which is really where we're trying to fund and support innovations, particularly those that are youth-driven, really community-based and designed for sustainability. And what that gives us, if you want to go to the next slide, is a fair bit of experience funding here and some knowledge that we can build off of. So this is just our mental health funding to date. And since we launched in 2012, there has been a big shift. And as you may have heard from the introduction, Ellen at one point was involved as well. So you can hear from both of us in the discussion around what has changed at that time. But there is a much stronger evidence base for mental health treatment since we first started funding in this area. We've seen that evolution, including in low and middle income countries and in low resource settings. So things like task sharing models, so where non-specialist providers deliver mental health interventions, have strong evidence base. We can see this in various types of different programs, things like the Friendship Bench in Zimbabwe, Thinking Healthy program in Pakistan. They've all shown different types of effectiveness at different levels of scale. There's a strong evidence base to support things like brief psychological interventions, things like Problem Management Plus developed by WHO. It's been now tested in a diverse range of humanitarian and low resource contexts with good evidence both for feasibility and impact. There's a promising and kind of continuously growing evidence base around digital and hybrid models, especially thinking about that for young people. Of course, this is still in development. But there are some strong signals, and what we're also seeing across these areas is that there's a growing number of really effectiveness implementation studies really looking at how some of these interventions can work in real world conditions. And so I say all of that, if we have the stronger evidence base, we know what works and that there are things that works, and of course adaptations need to happen for different contexts, but we've got a sense of what can be successful and what can have impact. And yet what we don't see is a massive amount of scaling. This translation of really this strong evidence base into widely accessible programs and scalable programs the promise of that has yet to be realized. And some of that is a lot of these programs end up being trapped in kind of a pilot or a research mode. We have a bit less data when it comes to long-term outcomes, when it comes to how to integrate into systems, when it comes to cost effectiveness at scale. So, and often while we know what works, we lack more evidence into how to deliver things sustainably, including across different contexts, things like schools, primary care, community-based care, understanding the necessary workforce models, understanding financing mechanisms. These are all big gaps where we've got this this strong evidence around innovations and programs that work, but the systems to be able to take these up and to integrate them and to implement them in a sustainable way are still lacking in a number of different contexts. When it comes to young people, the evidence gap there is a little bit larger. There's certain elements of what we still need to grow that evidence base. That's part of what Ellen was talking about, including thinking beyond that kind of individual level therapy, but also to addressing structural and social determinants of health, which are so important to look at. But what we really see here is that oftentimes the roadblocks aren't always about the effectiveness or the impact. It's about scalability and it's about sustainability. So monitoring infrastructure and policy alignment and financing, these are all really critical pieces that we have to look at. So if we go to the next one, this is just our model. And so it's trying to bridge the gap between proof of concept to scale by combining seed funding, transition to scale investment, and this new thing we're looking at, ecosystem catalyst grants. And I should say all of what's on this slide is just our funding in mental health. And the goal here with the ecosystem catalyst, which is a new thing we're testing out, it's about, we're learning that these, one-off program grants, they're not enough. They're not going to be setting these programs, these teams up for the pathways and long-term sustainability. And instead, we also have to think about what needs to be done at a systems level to help support it to be able to take up these different solutions. So what are the different barriers that we need to unlock to be able to support systems to implement interventions at scale? Some examples of what we're testing and supporting in these areas are things like how to have ecosystem grants that are tackling fragmented governance, lack of training platforms, a lack of reimbursement pathways, or siloed data systems. All of these are different challenges that are act as barriers for innovations in mental health to really be able to scale. Also important around supporting implementation partnerships, things like bringing governments, researchers, youth-led groups, service providers together so that the evidence can be translated into also policies and services. So it needs to go both ways. And then a big piece there is also, of course, around costing and financing. Governments and payers need to have the data to be able to fund and adopt programs because we can't scale what we can't cost. And an element here also just around policy alignment. How do we support, one of the things we think about is how do we support the programs that we fund to be able to engage with the relevant ministries, health, education, youth, to embed treatments into national strategies. And really thinking about this systems orienting funding, because even the best treatments won't help if there's no infrastructure to deliver and sustain it. And we really need to think of these as how do we support innovations to be these embedded and really funded solutions, as opposed to those that have to continuously get into that vicious grant making cycle that was already mentioned. And then the last thing, and I'll say, which is the next slide, and I'm this is our flagship initiative for youth mental health. And what we're trying to do with Being is really think about how we support and fund across a range of these different areas. So learning, how do we fund research that has actionable policy recommendations? How do we build those feedback loops that connect back in? How do we do our investments in specifically youth-led projects, youth-led organizations? And how do we work to mobilize? How do we bring those systems together? Because our job really as funders isn't just to support programs and innovations, but also to consider this broader systems that these innovations are implementing in and how we can help facilitate some of those connections. And then one of the pieces I just want to say quickly, though I know I'm going over time, is I'm really looking forward to the discussion and to be able to respond to some of what Aliza mentioned around these challenges. And then I promise none of this was planned, but one of the things that we have done that's made it be really effective for us is that we do go to young people to support what should we be funding through this program, and have young people as reviewers to say, and look at these projects and tell us what are the ones that should be funded, and how do we work criteria into our review process that actually helps to pull out and highlight youth-led projects and youth-led organizations, because we find at GCC that those that are closest to the problem are the ones that are going to come up with the most relevant and the most feasible and the most sustainable solutions. And that's really what we're looking to support. So thank you.
Thank you so much. So before we turn over to Tracy, again, I do think this is a great segue to what Tracy is going to be talking about. But just, the good news that you mentioned is all the progress since 2012, at least on the evidence base, on knowing what to do and all of these innovations in service delivery. It's fantastic that that's happened in such a short amount of time. And I really appreciate you raising all of these issues with the challenges at the system level. And the thinking that you've already done to work through, or at least the identification of the barriers that exist across the different systems within countries. And then, thinking maybe there's implementation research opportunities for understanding how it might have worked to scale up in one context that could be applied to other locations. And also, factoring in that each context is dynamic in and of itself. But also have to say, we appreciate that you've already taken on board some of the recommendations that we heard from Aliza around the engagement of youth and figuring out what really are the programs that matter the most to young people and having them evaluate the projects. I think that's excellent. So with that, now we get into Tracy's presentation that will move up a little bit from this global view and give us a little bit more detail on the U.S. Situation, which is reflective of everything that was just mentioned on challenges. And she's going to give us a little bit more around what a payer needs to support innovations in youth mental health. She's going to describe a bit the current funding climate and an example from SAMHSA's CCBHCs, which I know she will explain, that integrate multiple services. Just thinking again about this whole, the whole process of moving from research to practice to scale. So with that, I'm going to hand it over to you.
Thank you. All right, well, my current affiliations are on the screen here, but I'm really speaking from the perspective of a payer, so from the perspective of our prior role when I was the Medicaid director in Colorado, hence the shoe wearer. I've got a couple of questions about this. We heard throughout this conference that setting the context is important, and understanding public financing is fairly mysterious for many of us, even us that work in public financing. So the pie chart on the left shows adult financing in the public sector. So, our age group kind of splits between adult data and child data. So I'll try to voice over some of that. Medicaid's a core part of the financing structure. It's about a quarter of expenditures for adults, closer to half for kids. And then the other major payers are Medicare, private insurance. There's a fair amount people pay themselves out of pocket, either for services that aren't covered or they're uninsured entirely. And then we have the small bucket of miscellaneous local, state, federal funds. That includes SAMHSA community grants, which are small in number, but as you heard from Ms. Lopez a moment ago, really important from other perspectives than just direct funding. That's a lot of TA, a lot of capacity building, data and policy analysis, innovation, bringing the youth voice forward. You heard yesterday about 988. They were the major architect of that. And I'll talk to you later about CCBHC. And I highlighted in particular because SAMHSA is facing pretty major funding and staffing cuts, not all of which are clear, they're litigated. But if they should go through, including the most recent cuts during the furlough period here, more than half their staff would be cut before throughout 2025. And so I really resonated with a comment on the youth panel yesterday about part of our collective action will be rebuilding some things as well as building anew. I'm going to switch gears now to Medicaid. And, Medicaid wasn't always as foundational as it is now in terms of supporting community-based behavioral health services. It was in 2014 with the ACA that low-income adults could be covered under Medicaid. Previously, it was primarily a program for pregnant women, low-income children, very, very low-income parents and people with disabilities. And so what happened in communities is you had a lot of uninsured people, and the behavioral crisis system was the hospitals and the jails. Now, some of that continues today, but it was much worse prior to 2014. The map on the left shows you the states that have expanded Medicaid to include low-income adults, which is most of them, but we are still missing a few of them. And really what this provided was a financing stream for the states that expanded to really build community-based services, invest in prevention and screening and all the things we talked about yesterday and today that are critical. And there's a special policy hook within Medicaid that really allows you to focus on children. And in Medicaid, we define children under 21. And so to really build out those tailored services, that's EPSDT. So this relatively new system was critical during COVID when we had the explosion of the youth behavioral health crisis, which we've talked about at length during this conference. It was also tested during that time, and it exposed gaps in terms of health equity. It exposed gaps in terms of the care continuum, and all of that prompted some pretty substantial state and federal investment. And so we got some of the things, again, we've talked about a lot: crisis services, 988, peer support, SUD treatment, high fidelity wraparound, residential and step-down options, and telemedicine and tailored virtual approaches. And there are many remaining challenges, of course, but I did want to pause on the telemedicine front because that actually ramped up before you saw this big increase in investment. If you look at the graph, you'll see that Colorado, which is just representative of most states, doubled their investment in behavioral health over the last 5 years. So now it's about at that 10% mark where we said we wanted to be as public sector funders. But telemedicine ramped up kind of right away. And in reflecting on how that happened, we had our research community come together with the government, coming together with the delivery system, and we just had a shared sense of purpose and urgency that we will not let the healthcare delivery system collapse. And we collectively got over ourselves. You know, I looked critically at our regulations. What can we change? What can we petition the federal government to get rid of? Where can we take risks? The delivery system worked all weekend for months and months, creating workflows. The researchers brought us their best ideas and didn't look too close when we weren't implementing to fidelity. And we were able to get it up. And initially we got up over the phone, but eventually we moved toward fidelity. And so I just pose it to you as another pathway, potentially. So we're at a similar inflection point. For those of you that are living and working in the US, we passed a big bill in July, perhaps you've heard about it, that will have the effect for the Medicaid program of reducing federal investment to the tune of almost $1 trillion over 10 years, and will likely result in lots of people, again, losing coverage, about 10 million people, we think. And that federal divestment sort of rolls down to the state level. And so in my former role, you know, I would have faced a host of sort of unpleasant choices. I could try to get my community rallied around raising taxes to, you know, to backfill the federal dollar loss. That's very difficult in some states. We could reduce the people who are eligible for the Medicaid program, which includes the Medicaid expansion, and that may happen automatically in some states due to existing state legislation, which is what you're looking at on the left. I can reimburse my provider community less, I can reduce benefits, or ideally, I can innovate, and you know, we can innovate, like we did with telemedicine. And likely states are going to be doing all of these things. So I really wanted to think about, you know, how do we leave this conversation with a little hope, right? I know I've depressed you, so now this is the you know, rah-rah part of the presentation. So thinking about that telemedicine example where we really were able to take an idea we've been talking about for 30 years up in 3 weeks. We look for ways to work with the existing system. And so what is Medicaid already paying for that sounds like what we want to do? And so the example, and it is really an example because there are other examples I wanted to bring to this group was CCBHC. And I brought it for in particular because I thought it fit really well with a lot of the topics we're talking about here. You know, it's person and family centered. It's got 9 standards that are define at a policy level where there's some room underneath to innovate clinically. And in many states, there's an existing Medicaid payment model, not just a SAMHSA payment model. And historically, it's enjoyed bipartisan support. So the way I'm thinking about this is that in addition to sort of the traditional pathway where we develop an intervention, we get it, we're really happy with it, and then we approach the payer and say, could you pay for this, please? I'm sort of thinking this as cross-sector communication like we talked about yesterday, where we get the care folks and the payment folks talking much earlier in the process and using all those skills, arriving at each other's love language, developing a shared purpose, and looking at the existing model is not perfect, likely, but scaffolding for what we want to do. And so just thinking about some of the things we talked about just today, we heard about United Youth, I think Unified Youth, building a pipeline of youth certified behavioral health coaches. Maybe that could nest under crisis services. We talked about task sharing, which frankly was a new term for me. And that sounds a little bit like team-based care. I don't know if it is, you tell me at the break. But we know how to pay for team-based care in Medicaid. And so looking for ways to leverage the existing payment system to advance our work. And that may require Medicaid programs to think differently about their regulations, and it may require you all to think differently about your interventions. But what I heard from several people on previous panels is that sometimes making compromises about the intervention allows you to scale and get people enrolled more quickly. Finally, CCBHC is a good example of another area where our love languages might talk to each other. It's very operant in payment reform to talk about value-based payment, which just really means merging these ideas of health outcomes with cost effectiveness. In a lot of the worlds that you operate in, the research world, we talk about qualities, or cost benefit analyses. So again, sort of using this existing model to sort of bridge our worlds and implement services more quickly. In closing, I did want to underline another point that I heard, I think most recently from Dr. Sangrala, I hope I'm saying your name right, that I love this idea of reciprocal innovation. In the US, we're going to be comparatively to ourselves resource constrained. And so really looking for what we can learn from global leaders like you to implement interventions that are in much more resource constrained environments than we're in as a way to kind of innovate and advance going forward. Thank you.
Thank you so much, Tracy. So I just have to comment that I lived in Austin, Texas for 7 years, and cowboy boots are, integral to everyone's wardrobe. So thank you so much for that. That was excellent. I really appreciated the bringing out of the silver lining of the COVID, where it made evident health inequities, and then there was a sort of increase in funding to address that. And then, of course, now we're in a constrained funding environment, but that actually, to me, speaks perfectly to this issue of resilience of the system. And the fact that on the one hand, government is your friend, and then the other, you have to figure out how the love languages will work together as administrations shift. So I think that's really important for everyone, and it speaks to this issue of the challenges around scaling, because the scaling is happening within a particular political context. So it all needs to be factored in like that. And I so appreciate all the effort that you've made through CCBHC to think about how in this current context, you can make things work with the system as it is, and make sure that I also just really wanted to flag as well, I appreciated the continuum of care concept that you brought up. So it's a full package of services, and how do you make sure that all of them are available, not just one or two. So I really appreciated that. Thank you very much. And then also, I just did want to note that I do think it's really important, this cross-learning, not just this idea that innovations move from higher income settings to lower and middle income settings, but that there's now this process that is really important about learning what low and middle income countries have done that we can apply here. So thank you very much for that. So now we are on to an exciting portion of our panel to move into some questions, and then we're going to open it up to the floor to hear from all of you, because I'm certain that you have questions that you'd like to ask. But I first wanted to come back to Aliza, our first speaker, because all the other panelists have tried to address your challenge of better engaging young people in the financing full process of grant making. So you heard from our colleagues online about engaging young people in the ideation process and then also for peer review. But are there other thoughts that you have that we could think about even further, reflecting on your presentation and other things? What else that our funders can do?
Yeah. Okay. Yeah, I definitely think that involving youth at like all parts of the process is definitely very integral. And I know I'm very familiar with the fact that a lot of organizations have started to integrate things like youth advisory boards and youth advisory councils like into place. I believe like a previous panel touched on this yesterday, and I feel like these youth advisory councils are like popping up one by one and they're becoming so rampant. But I feel like from what I've seen, a lot of them do tend to be a bit tokenistic. I definitely feel like they're kind of there just for show, and they're answering questions that the organization may have about, oh, how might we do this? Or, hey guys, like, what do you think about this? But I truly believe that there is a difference between listening versus understanding versus implementing. And I think that is definitely a concept that we should always strive to think about when it comes to even involving youth, even in the financing and the grant making process. I think like definitely having our youth as peer reviewers, I think is very important, because although our panelists mentioned that having that technical experience and having that those like technical reviewers like on the panel is definitely very important. I think just having that youth like perspective based on their own lived experience is just as important and just as valid, because a lot of our mental health experiences shape us to be who we are today. And that is definitely a voice that should be through in the grant application process. It shouldn't be just solely technical. It should also speak to our personal experiences, because we are ultimately the ones benefiting from it as well. So again, when it comes to integrating youth, again, like we are not here just for show. We are not here to put up an image that, okay, like you have youth, like this is great. We do ultimately have a very good purpose when it comes to the evaluation process, and we should be sought out because we have that inherent value and not because we're here for like, I don't know, like our age or just because we look good, but all that to say, youth are very important in this process, and our insights again are very important. So again, don't tokenize youth. We're here. So
thank you so much. Okay, Tracy, I'm going to turn to you, and you can answer that question as well. But just a little bit further, we've heard that financing for adolescent health and adolescent mental health in particular doesn't match the need. So especially if you think about it in relationship to prevalence, what we're offering is insufficient. So what are some levers to pull in the US to affect these investments for making sure there's access to care from the whole continuum of care that you mentioned? And then from your perspective and all of your experience, what can states learn from each other, and what can, as you already pointed out, this whole idea of learning from so maybe if you could build on that a little bit further.
First part of the question.
Right. Can you hear me? Yeah. Okay. So I think one thing that that CCBHC example, and again, you know, there's other care models, like in Colorado, we're building out high fidelity wraparound services. So again, please do take this as a model, but the model I have in mind is there is an existing model on the ground in a state that has some financing behind it, and may not have everything else in place, including the best practices. And so that's where we can marry. We've got the sustainability path. We just may not have, you know, on the ground, the really evidence-based thing. So what I liked about it when I thought about this presentation, this idea is it also brings it closer to people. And I was thinking researchers, but like reflecting on your comments today, Aliza, it also brings it closer to youth having direct opportunities to participate. And I'm thinking boards, not just advisory boards. You know, most of these organizations are nonprofit, and so they have boards. Sometimes they have boards that are consumer run or looking for consumers. And just in my own community, you know, I was getting together with the other gray hair ladies, and we were talking about how we're on a ton of boards, and all of our boards look like us. They are often people who are older, often retired, and we're like, we're handing off these delivery systems to people who are very much younger than us, growing up in a very different age. How do we get younger people onto board? So I just think there's really a great opportunity there. And then you're more at the seat of power. You're not just advisory, you are making decisions. So that's the first part. And I think the second part of your question, I'll actually get to the presentation this afternoon where we talk more about data and how we can share across states. So
Can you all hear me now? Okay. Do we have time for one more question? Okay, so now I'd like to turn back to you, Ellen and Nicole. So in the previous panel today, we heard about supporting adolescent well-being in the community as well as outside of the health system. The commission itself calls for more investment in prevention of mental and behavior health problems as well as promotion. So from your perspective, from both ends, from the earlier research-oriented phases of funding needs to scaling up, what does it take to balance these investments in care treatment with prevention and mental health promotion? And when you think about your work in your organization, how do you prioritize these different areas? Easy question.
Thanks for that. I'm happy to kick it off with a bit of a response. So I think that as Nicole sort of spoke about before, I think there's been sort of great progress over the past 10 to 15 years in terms of building an evidence base for mental health sort of treatments. I think we haven't seen similar progress yet in terms of the evidence base for sort of prevention and promotion. And I think that's an area where there needs to be sort of continued investment in the evidence base, and also not just, and I think it's not just about sort of funding necessarily new interventions, but also taking existing ones and trying to figure out why they work the way that they do. And so that can include, you know, taking something that has worked really well that might have multiple components and trying to break it down and figure out actually which is the component that is, you know, potentially the most important, particularly when we're in a context where maybe there's not enough funding to cover all components of it, and to try and break it down, or even to do the opposite. If you have an intervention that is pretty good, but if you combine it with another one, actually the results are amplified. So I think there's a little bit of playing around even with the evidence that we have, that we can do to make more effective and potentially more sort of appealing interventions for prevention and promotion. I think the other, you know, really important thing that we're trying to do at Templeton is, the earlier panel spoke about sort of the need to move beyond a deficit-based approach to mental health care. And that's really sort of the position that we take. It's all about sort of what are the positive skills or attributes that can be built, and how do those support sort of mental health and well-being. And you know, when I speak to researchers in the mental health space, this is something that everybody really sort of clusters towards. Like, I think there's general acknowledgement that this is something that needs to be done, is to move beyond the deficit model. But the question is, you know, how do we do that? And how do we sort of shift those priorities? And I think there's a couple of areas that I think we need to invest in a little bit more as funders. And one is more a little bit about measurement. Like, what are we actually measuring when we're talking about sort of prevention and promotion, and sort of how do we do that accurately in different contexts beyond simply asking people sort of how they feel on a self-report measure. So I think there's a lot of innovation in measurement that potentially needs to happen. I think there is also sort of the opportunity to, again, as funders, as organizations that are working both on sort of an asset and deficit-based models, to come together and do a little bit more sharing of sort of what's there and what works and how can we piece it together. So I'll stop there and turn it to Nicole.
Yeah, thank you. It's not an easy question to answer. Like, how do you prioritize? I don't know if you can. I think both are really important for the different reasons, obviously, that everyone knows and have been mentioned. At GCC, we've historically focused on treatment, and in the last 6 years started to look more around prevention and promotion when we shifted to focus more on young people, because there's that opportunity there. To be able to equip young people with the skills and supports that they need early. And so I think it's a mix. I also think, as Ellen mentioned, the types of funding that are needed for both are very different. Where are you funding earlier stage ideas? Where are you trying to support scale? And that looks different across. And then I think the reality is that, similar to what Tracy just mentioned for the US context, the global health funding architecture and the global health architecture is being reimagined and redesigned right now, with cuts across the board. And I think for funders, what's important just to keep in mind is the needs of the communities where these programs are implementing, and being able to continue to represent that in the work that gets funded. I don't think it can ever be a one versus the other, but just what's the right type of funding and the right constellation of partners to come together around these different the different needs in these different kind of areas across a continuum of care, and hopefully not siloing ourselves within an already, like within an area. I think we talk a lot about how this mental health ends up existing too much in a silo. It needs to be integrated into other health areas, other broader education, etc. And I don't think what we want to do is then silo within mental health as well. So thinking about how we kind of support across a continuum of care and integrate programs and funding initiatives.
Thank you both. Really great interventions. I appreciate so much the whole idea, Ellen, coming from you around coordination, both between sort of the what you mentioned in your first presentation around making sure that once there's a research idea that's been further developed or evidence base has been developed, is making linkages between the funders that are supporting that with the funders that are then going to bring it to the next level to scale. So I appreciate that. And I feel like that was echoed again in both of your comments around the coordination with the asset-based and deficit-based models. So how can that be brought together so that there's a little bit more synergy? And really appreciate this idea of the coordination across donors about what needs to be funded. And the whole funding ecosystem is obviously changing, as we know, and you pointed out, but it's even more important for there to be alignment in this kind of a context. So really thinking that through, I think, is essential. And I like the flag for the later panel after lunch, so everyone has to stay. So now it's your turn to ask questions to the panelists. We have a little bit of time. If you have any burning questions you'd like to ask from our experts here.
Over to you. There's a mic over there. I gotta go over there. Good, I knew my steps today because I didn't have the cookies. Bad choice.
So, Teresa Betancourt, Boston College, we've been really honored to be a part of the Bean Initiative. And Nicole, as you know, we work in more affected settings, and I was talking about this on the panel yesterday, that oftentimes ward disseminates infrastructure. And so I love that Bean has this element of the sustainable business model sort of part. I find that in working with local organizations in more affected settings, they often don't have a lot of support on the non-sexy stuff, like how to have a human resources strategy and, burnout prevention, supervision support, staff policies, insurance, stuff like that, is especially in more affected settings. And I'm just wondering, where are you seeing innovation in those two themes, which I think need to be there for getting to scaled sustainment with quality in more affected settings? The non-sexy stuff of management and administration, and also the self-sustaining business model. I'd love to hear successful examples because in Sierra Leone, we're certainly trying to learn.
Yeah, Teresa, it's a great question. I don't know if I have an easy answer. I don't know if I have something that fully comes to mind around like where we have in war affected contexts these business models. It's one of the things that we're seeing is that often even organizations or programs that we've been funding for upwards of 10 years are still primarily reliant on philanthropic funding. I think it's part of this issue is that there isn't an end payer. Like, who is the end payer in these contexts? You're not going to have a fee for service model where the user is the end payer. That doesn't feel feasible. Governments rarely are putting money towards this. You know, the average is less than 2% of health budgets go towards mental health. And in many of these contexts, that's going to be even less. So who the end payer could be, who could then make these kind of sustainable business models, is where there's these big gaps. It's why we think the systems work needs to happen. Like, this can't be on an innovator or a program's side of their desk, something they can figure out of how to create these, I guess, financial potential that isn't there. So it's an area I think we really need to understand better. It's an area as funders we need to think about how we support the things we set up for success. I think there's different types of funding models that's, you know, innovative financing that we can consider of how to really support some of this. But I do also think it needs to be the system that can respond to it. Because the fact that I can say that we've done over 200 investments and I can't come up with an example for you is a pretty big problem. And I don't think the problem's at the innovator level. I think the problem is at a systems level, that those pathways just aren't existing yet. And I do think some of the other piece you mentioned also so important. We see that as well. It's why GCC does the non-financial support in addition to financial support. So what do you need? Sometimes it's how do you develop a finance policy? Who do you have that's like signing off on different types of, organizational governance, all of this? For things to be successful, for organizations to be successful, you need to have those things in place. And it's not the stuff that often gets funding. So it's partly what we really prioritize our funding to do. It's what we think of as part of the de-risking. Like, how can we help set some of that up? And I see that becoming more and more of a trend in the funder space to provide some of that type of support for these exact same reasons. I don't know if I answered your question, but I did my best. And I think part of it is there's no easy answer there, unfortunately.
Please go ahead over that side.
Okay. Thank you so much, everyone, for speaking today. So my name is Lindsay, and I'm a recent graduate from the Department of Mental Health here at the School of Public Health. And I'm currently in the early stage of a digital mental health solution, currently in the validation phase. So I have a question, especially for Dr. Morgan and Dr. Bardikoff, for founders that are building strong domain expertise, but have limited technical capacity in building their solutions. What strategies have you seen work best for building out these solutions so they're ready for funding? Thank you.
That's a great question. So I can speak a little bit from the TWCF perspective only, as I'm sure it's different depending on funders, but so I guess the first thing that I would say is to reach out to whoever you're interested in applying to funding for, to really understand sort of what types of supports are available for part of both the proposal development process and should you be awarded a grant, sort of what the space is. Because something that TWCF did, pretty early on is that we found in one of our early requests for proposals, we were getting like really great ideas in, but a lot of these ideas weren't passing the peer review stage because of essentially, they weren't scoring very high on sort of the technical competencies or methodological competency. So something as a foundation that we decided to do was we actually had a 2-stage development process where we took in sort of a bunch of what we considered were the best ideas, and we actually matched applicants with experts in specific technical domains who could then help the applicant actually develop an even stronger proposal. So by the time that the final proposal got to us, there had been a little bit of an evening of the playing field, if that makes sense. And so, I think every foundation might approach this differently, but I think, as Nicole was mentioning, a lot of foundations recognize the need to have sort of some capacity building, some community building, some non-financial support in there. Sometimes that'll happen even earlier than the actual sort of award phase. Sometimes that happens as part of the award process, but it's really worth sort of asking the question to see what's out there, I'd say.
Yeah, Ellen said it really well. I would say the same thing, ask the question, and also look to your community where you are, others who are doing this, speak to other people, organizations who do similar work or who may have been able to build some of this. Because I can see, I understand what you mean of some of that being continuing to be a barrier to getting the funding, that you need to then be able to develop that. So I think looking for those resources that might be available from potential funding organizations and speaking to others who may be doing it, because I'm looking, I can't see the room, but I have a sense of potentially some of the people who are there. And what I tend to have experienced in the mental health research implementer funder community is that everyone's incredibly collaborative and very happy to support and help where they can. I'd say leverage that where it exists for you.
Yeah. And maybe just, if I can just add sort of another scenario that we came across at the foundation, is that we had invited some applications, and there were sort of 3 projects in a single country where, again, the prototype was really good, but they all needed some type of platform to really sort of get this prototype or this intervention sort of out into the hands of, in this case, educators who would actually use it sort of in a feasible way. So they needed a good sort of user interface, a good training system. And so, as a foundation, we saw these 3 projects that sort of both had the same needs. And so what we actually did is we provided a grant to a separate organization that had a really well-established platform to essentially work with these 3 to sort of develop the dissemination, the teaching, the training materials, because we knew that they did high quality work. So again, sort of, put the ideas out there, talk to people, because sometimes, these things can be pulled together if everybody essentially is talking to each other.
We have 2 more questions.
Hi, Shami Fineglass. So, Ms. Lopez and Tracy, you have given me a really interesting idea around grants and board of directors and service on boards. So my question to the audience, how many of you are under the age of 28? Or 29? Okay, so the rest of us are a little bit over the age of 28 or 29. And so I'm going to throw out a challenge. How many of us are going to ask some of the people who you saw those arms raised on to serve on either your boards or be PIs or participants in the grants that you're going to write next? That's the challenge I'd like to throw down, only because Ms. Lopez and Tracy gave me this idea by speaking on this panel. It's something I serve on boards. I run different companies. I work at a consultancy. And I think we are not reaching down intergenerationally deep enough to answer this question together. So thank you all.
I have a really quick financing question about CCBHCs. So we looked at value-based payment, alternative payments, trying to figure out how to recoup any costs from this to actually pay for training and possibility and quality assurance. Are you seeing that? Do you see more possibility for that in CCBHCs than other kinds of payment models? We're trying to figure out how to use value-based payment or alternative payment infrastructure so that the organization is getting, more money they can then invest in actual capacity building or training. I don't think you're right.
Magnetic field.
Yeah. Yeah, well, I can't swim through the X-ray. So seriously, on the final slide I showed you, there is actually a new federal initiative called IBH, where they're trying to marry value-based payment with a Medicaid care management platform. You can use CCBHC, you could use health homes, you could use a variety of different things. And so like that's what specifically comes to mind. So what that would look like is you would need to partner with a state that you work in and convince them that they want to apply for this thing. But I've actually heard there are a number of states that are actually looking at this and thinking about applying. So it's not, and it wasn't just like one or two, there were like half a dozen or so that were interested, and we could talk offline if you wanted about, we just hearing about, but so the closest thing that CCBHC has right now are kind of all the incentive payments. So they're not exactly a full value-based payment model. So, you know, if you were to kind of say like, okay, I want to go where they are, you know, is there a way you could do what you're proposing within that frame? Like, I think, you know, so you pick a community, CCBHC in your community and say, I think, yeah, I can help you hit these metrics by doing this training that I want to do. You know, could we partner together and see if, you know, if you fund my training, I can help you hit this quality metric. Like that's the mechanism that exists today. Did I answer your question?
So thank you so much. We're going to close the panel, and I want to really thank all the panelists for their excellent contributions and also for the participation from the audience. Just a few summary remarks is that I really liked that we moved from the youth engagement issue as the first point of call. And then thinking about it, we also had this sort of accountability, you know, put it to action in the end here about really thinking through how we can really engage youth in the proposal development process, the engagement in the design and implementation of projects, and overseeing as well, being on boards and things like that. I think was great. And then also just really want to stress again the funding architecture, the ecosystem, this call for greater coordination from those that are working on grants that focus on evidence generation to those that are looking at scaling up, and that also includes implementation research and lessons learned and sharing. So that whole thing around coordination, I think, is really important. And then the US example around resilience and how you work with existing systems, whether the funding architect is great or not so great, and how you have to constantly be innovative and adapt. And again, this whole thing around collaboration and working together so that there's a full package of services that are made available to young people. So with that, I'm going to close and send you all off to lunch.